the Ugandan dentists were the most enjoyable professionals to talk with and so open to new ways of doing things. And they loved teledentistry. There's only 300 dentists in the country of Uganda.
Wow.
So that's one dentist every 10,000 people. And here, our objective is to get one dentist every, I think 1,200 is the max, population. So they need a lot of help. But if we work on prevention and start prevention with small children, and you can do fluoride varnish, they now have silver diamine fluoride, which stops decay. We taught the Ugandan dentists how to use that, how to apply that and left supplies with them, and grow that, from the ground up. Then 20 years from now, hopefully we'll have a better handle on oral disease globally.
Hey everybody, welcome to the Going Beyond the Deal podcast. I'm your host, J. Michael Fischer Jr. Healthcare has been traditionally built around physical presence, offices, waiting rooms, face-to-face interaction. That's how trust has always been established. But at the same time, millions of people still struggle with access to care when they actually need it. Today's conversation is about what happens when someone decides to challenge that model. I'm joined by Dr. Maria Kunstadter, CEO and co-founder of the TeleDentists, one of the first nationwide teledentistry platforms providing virtual dental care 24/7. This conversation really isn't just about dentistry. It's about access, trust, healthcare innovation, and what it takes to build a mission-driven company inside a system that wasn't necessarily designed to evolve quickly. Maria, it is great to have you on.
Using quickly and in healthcare is those two words don't go in the same sentence.
Those do not work. But we're very excited to have a woman executive in healthcare. Maria shared with me before we started, only 4% of executives are women. So it's great to have you on, Maria. You got to give us the story. How did you come to be, at the helm of TeleDentists?
Well, thank you for asking. It's one of my favorite stories. So I am a dentist, duh. And in 2012, 2013, when the opioid crisis was coming to a head, I was appointed the dental director of a group trying to address chronic pain patients because the opioid crisis was coming to a head. And I talk with my hands, so I hope that's not too distracting.
No, I love it. I love it.
So I was in Washington, D.C. in 2012, 2013 with these big healthcare groups. I call them the ABC groups from the government. It's always HHS, QQ, et cetera, CDC. There's never a real name for these organizations. I don't think so. But over and over again, from, talking about opioids, people would go to the emergency room because then they could get opioids for anything they complained of pain. And in the top 10 reasons people were going was toothaches. And I'm probably the only dentist in the room going, well, that's crazy. I mean, why would anybody go to an emergency room with a toothache? There's no dentist there. It's a low acuity need, so they'd wait for hours. They'd spend thousands of dollars more than they would if they went to a dental office and still get no care. They are just, given medication and kicked out and told to go find a dentist. But at my table were a bunch of, I call them smart people, and were physicians that were at that point doing telemedicine. And it was like a perfect storm. It washed over me. That's what we need. We need a virtual dentist. I say in all the wrong places people go for toothaches, including pharmacies, urgent care, hospital emergency rooms, and the TeleDentist was born. And it was 2014 that pushed us to incorporate when the American Dental Association came out with a study that said in 2013, 2.2 million people went to the emergency room with toothache codes and cost our government $2.1 billion healthcare dollars. And we incorporated and started developing. We were the first, by the way, teledental platform, consultation platform developed. So it took, development time, software engineering. And as a dentist, I manage my cell phone, and that's about it in terms of IT. So it's getting the right companies to put together a platform and testing and marketing and et cetera. This whole new concept of getting a virtual dentist in the right places. And not quite fast forward, we realized our little boutique platform we had developed was going to be too small to take this nationally because this was a national crisis at this point. So we went on a telehealth platform that's used internationally and in the space station, and they white labeled for us. So we're hosted by VC on their platform as a private company. And then that was in 2018, 2019, still pushing this giant boulder uphill, and COVID hits. And in March 15th of 2020, COVID hit. And within the next 3 quarters of 2020, 3 weeks after March 15th, we had a contract with Cigna to provide teledentistry to their members. People were stuck at home with pain, with problems, and afraid, and didn't know what to do. Right after 3 weeks after Cigna, Anthem came on board and wanted us to take care of their members. And in 2020, we just opened our emails to see who needed us to provide help for their members. And we grew 1,200% that year. So COVID really put teledentistry on the map. People finally understood they could actually talk to a dentist virtually and consult with them. We e-prescribe, our company takes it one step further than telemedicine does. We actually help them get an appointment in a dental office if they don't have a dentist. And unfortunately, in this country, 50% of the population doesn't have a dentist. So we have a lot of work to do.
Got it. Yeah, I'm bad when it comes to the dentist. I'm really
one of them.
I'm one of those guys. When I think about telehealth, it made a lot of sense to me when I was talking to people about telehealth, and it was like, okay, certain people couldn't get there. They knew it was like kind of a routine thing that they might have an issue with, and they could just get on the phone with a doctor, get a script done. But with dentistry, I always feel like it's so much more hands-on. So how does it work? I mean, for teledentistry, it's mostly I have a pain, I have an issue. Kind of walk me through how the conversation goes.
It's exactly the same as telehealth. And what I love to compare when we're with telemedicine companies, I'll say, and people ask me that question all the time. You're not the first one to ask. I'll say, look at what telehealth says they treat. They say cough, cold, fever, urinary tract infections, and more. And what I love to tell people is if a woman presents with a UTI, the doctor doesn't get all up in there to see if she really has a UTI now, does he? No. They talk to her. They talk to the woman. She's probably had this before. The symptoms are just standard, and they know what medication works. They know what to prescribe. And the closing sentence of almost every telemedicine teledentistry visit should be and is, if it's not better in 2 weeks, go see your doctor. And we do the exact same thing, except we take it that one step further. Do you have a dentist? If not, let's help you get into an office that will see you and start addressing your problems to begin with. It is a telemedicine consult with dentists answering the phone. And I loved your introduction, Michael, where you said it's a trust building, healthcare is trust building. We have a 95 net promoter score, which means which is really high, good eyebrow.
That's great. Yeah.
Which means 95% of the people that talk to us would refer us to their family or friends. That's a net promoter score, in case anybody doesn't know that. Because a one-on-one with a healthcare professional is such a unique experience. Patients love it. Because in a dental office, for instance, the staff was coming in, buzzing your ear, you have a call on line 2, or there's a patient in room 4. And there's always this kind of activity going on in most offices, where on a consult, just like you and I are talking, they can look directly into the eye of the dentist and say, here's what's going on. Nobody else we're HIPAA compliant, of course, and telemedicine compliant, and there's no distractions. And they actually ask the questions they want to ask. They get answers to the questions they want to hear. And they get, the 3 pillars of what we do is we educate them on what's going on. You get the right doctor to the patient with the symptoms, and they'll know what's going on. So we educate them on what's going on, what to do about it, and what's going to happen if they don't proceed with the treatment. They usually come with pain, broken tooth, abscess, infection. And so we make sure that they understand what they need to do and what will happen if they don't. Then we palliate. We can do e-prescriptions. We don't do narcotics, but we do antibiotics if need be, non-steroidal anti-inflammatories, antivirals if that's the case, whatever medication might actually help the patient. And then down that dental aisle that people just don't even know, there's temporary filling material if it's cutting their tongue. Someone will call and go, because the broken tooth is cutting their tongue. And that's what really hurts. It's not the broken tooth, it's their tongue's getting cut. So you can, the dentist knows what to do to help palliate them for what's going on with them. And then we triage. So those are the 3 pillars. We educate, palliate, and triage them to a hands-on care facility if needed.
Got it.
Post-patient surveys, 43% of our patients told us their problem was resolved at the consult. Unfortunately, to my profession, we get a lot of calls that say, I have a dentist. I even have an appointment next week, but I can't get a hold of him, and this is killing me. Shame on the dentist. But, we need to be, the profession needs to be better about making sure your patients can contact you. So we're an intermediary. Can't get a hold of a dentist, don't have a dentist. What do I do? Oh my gosh. Toothaches just don't wait 2 days. I mean, that's a lot of suffering that goes on that we can help with in the intermediary time when they actually do get in to see it into an office.
Now, would you help someone to be able to get in a little bit quicker and based on if they have insurance, et cetera, who they can go see? That's a huge value there.
Yeah. We have a network across the country, about 60,000 offices that when we help them get in, they get in and that day or the next day, but they're already medicated and palliated. So it's easier to wait a couple days if you've had some recommendations and some prescriptions given than it is to wait 2 days with nothing.
Very cool. And then, how is the relationship? Do dentists really love having you as part of the network? How does that work? So
I say we're the dentist's best friend, because we're taking people that aren't in their office and putting them in their office. We're taking those 50% of the population that doesn't have a dentist, and needs help, and putting them in a dental office. In fact, you're one of 60% of the adult population that did not see a dentist in 2023. Only 40% of adults in 2023 saw a dentist. Again, we are their best friends in terms of getting the population we see into a dental chair.
Were you the first then for teledentistry?
Yeah.
And now, are there any competitors in the space?
Oh, yes. We call them knockoffs.
That's what I would call them. Yeah.
But, I have to be very philosophical. Brilliant. I didn't develop this, but someone said, if you don't have competitors, you probably don't have a market.
Yes.
That makes a whole lot of sense. And then my son's in Detroit, and we went to the Henry Ford Museum, which is fabulous. And his quote is, competition makes us better.
It does.
And that's what Henry Ford said. And how true is that? That if you just muddle along without anybody bumping into you, you don't have any motivation to improve. So I stick with those philosophical thoughts when I think about the people that are bumping into our space.
I love it. So, being first, in this space, what resistance or skepticism kind of showed up early on with this?
Oh yeah. I call it pushing that giant boulder uphill. And telemedicine wasn't as robust as, COVID really put us both all on the map. And I remember in 2014, when we thought about this and we incorporated, we went to the American Telemedicine Association annual meeting, and I'm now a lifetime member. And I remember the speaker saying adaptation by the physicians was really hard to get in 2014. And now, telemedicine's huge. Teledentistry is growing so rapidly. So the first resistance is providers wanting to work with us, but COVID changed that because providers had nowhere to go. They couldn't go into their offices. So we had 500 dentists come to us in 2020 to sign up to work with us. So we have a robust bench of dentists. And in telehealth, it's the bench providers are ones sitting on the bench, just like in sports, waiting to be called up. So we have a robust bench of providers, which is wonderful. And people are starting to gain the concept of how this is going to affect. In fact, there's lots of huge studies that show someone that's had a teledental consult go to their appointments at a higher percentage, don't no show, that they save money, the payers are saving money. In the case of EDs, our goal in our pilot is to show that the hospital will save a dramatic amount of money. The payers will save a dramatic amount of money by having and our retail prices on our website, a $64 dental consult rather than a $2,000 emergency room visit, which you get that's
nothing. Amazing.
Yeah. So that's our next pilot is going to hopefully start this summer.
Very cool. Very cool. So, we touched on this a little bit earlier, but, healthcare has traditionally depended on this physical interaction. And it's funny because, most people always say they don't mind going to the doctor. They hate going to see the dentist. But how difficult was it getting people comfortable with virtual dental care, but I would say maybe it wasn't quite as hard because they knew that nobody was going to be there, zzz, with the drill waiting, right?
So
And you guys would actually probably be great to like actually kind of say, okay, well, this is what's going on. This is what's going to happen. And like almost get that, like you talk out the fear a little bit before you
we
get
take them off the edge. Exactly. I call this the best healthcare tool ever invented.
Yes.
And I would say 96% of the people come to us on their cell phone. And everybody's used to FaceTiming, selfies, and all that. So that everybody's used to doing what we need for the technology. Even seniors like myself talk to their grandkids on the FaceTime. So this concept is already embedded in our mental thoughts, is how to use the cell phone for that type of thing. Now we get, people sticking their phone in their mouth and taking pictures all the time and saying it's great pictures because they're great visualizations. But my comedy routine is we also get people that they're doing a consult like this and then they go, well, ha, 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 ha. And the only person that can understand that ha, 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 ha is a dentist, right? Because we're used to having people talk to us with our hands in their mouth. But, they'll take us a tour through live video with their cameras to show us what's going on. And we've had a 92-year-old call us from the middle of Iowa on her landline. She had a computer. She got on the computer and then called us on the landline because she didn't have a cell phone. Cutest end conversation because she told us what pharmacy to send her prescriptions with. And she goes, now you tell them I won't be there for a half hour. That's how long it takes me to get there. It's like, okay, we'll do that. So it's not an age thing at all. It's just a matter of people, when they find us through either their payer system or on WebMD, through any kind of contact that they can connect to the teledentist, they can have that one-on-one conversation with a provider and feel good when they're done. And you're right, take them off the edge of how much it's going to hurt, how much worse is this going to get, and then how much it's going to cost. That's why people avoid going to the dentist, how much it's going to hurt and how much it's going to cost. So our dentist will talk to them about options they have. You don't have to spend a root canal on a crown if you don't want to. You can have the tooth taken out depending on you. And one thing we do, Michael, because I love our team tremendously, is we don't care what they can pay. If they can't pay anything, we get them into an FQHC on a sliding scale. Because we want them to get taken care of. And it goes to you. People don't know what they don't know. We had a man in South Dakota that was disabled call, and he needed help, but he was disabled and couldn't get out easily. And we found FQHC 6 blocks from his house that he didn't even know was there and would take him as a patient at a sliding scale. So we connect people to the help they need, not just on the phone, but as a follow-up. And basically, our mission is to get oral healthcare access everywhere. Rural health transformations happening now, they have to get oral health into rural health transformation. And the only way to do that is with teledentistry, because there's just no dentists are going to live out there and work out there. There's not enough money to be made. But again, a woman in Montana got a hold of us and she said, this is great because I would have had to drive 90 miles to my dentist to be told, oh yeah, this is what's going on and I don't have time to treat you today. Come back in 2 weeks. Here's your medication. Drive 90 miles home, drive 90 miles back in 2 weeks. And she goes, this just, eliminated a 180-mile round trip, because now when she goes in, she can actually get the work that needs to be done on the schedule.
Yeah, I think people need to be more open to getting to the dentist. So I think that this is great. One thing that I had learned a while back, a friend of mine kept having this like recurring cold and he was sick like all the time. And it turned out to be a tooth infection.
Oh boy.
And that's a thing that people don't realize. They don't connect their oral health to their overall health, which I think is very interesting.
Dental medical integration is a buzzword now that actually, they're finally realizing, cardiac, diabetes, you simply cannot get your A1Cs under control if you have gingivitis. That's an infection in your mouth, and your A1Cs are not, you can't control your A1Cs if you have an infection going on. Respiratory, obviously, if you're sitting there going, and you're inhaling all that bacteria, just exactly what you're saying, your friend's, respiratory system is getting all this bacteria into his system. Almost every chronic disease has some oral health implications to it. Improving oral health has been shown to reduce total healthcare costs by 12%. So adding oral health to the component reduces the whole healthcare costs by 12%. And if you look at our annual budget on spend, a 12% impact would be dramatic.
Would be very dramatic, very dramatic. So, you said that, now post COVID, you think telehealth is, has really become, mainstream.
Yes.
If it wasn't for COVID, do you think you would have had a lot more of an uphill battle
Oh,
with
yeah,
it?
absolutely.
Yeah.
Absolutely. Again, funny that you asked that because payers, insurance companies were never part of what we planned on as a vertical to go into.
Yeah.
Because as providers, you talk to any healthcare provider, insurance companies are always in conflict with each other. But because of COVID, the logic was people were at home. They were panicked because of what was going on and didn't know what to do. So it was logical to be able to be in their home and help them virtually. And so the payers have become some of our best customers in a vertical we really hadn't even looked at because of the challenges of dealing with payers, but they have been some of our best customers.
That's amazing. That's amazing. Yeah. The thing I feel like we're challenged with though, is we're so used to our routine. Okay. We go to the dentist once or twice, whatever it is, once or twice a year, we go to the doctor. It's how do we get more people to embrace the telemedicine thing? Because at the end of the day, it is such a time saver. My primary care doctor, it takes me a year to get an appointment with him. When I get there, I end up waiting like sometimes an hour, 2 hours after when I'm supposed to be there because he's such a popular doctor. But it's like, but I don't think people don't want to embrace these things. How do we get the average everyday person to understand that this option is out there?
Well, I mean, I think it's going really well, but it could be a whole lot better. It's just public awareness. For instance, many systems, many offices have a telehealth option for their patients. I mean, that's ideal. That so many appointments aren't hands-on, follow-ups, consulting about prescriptions. I mean, there's so many things that we don't need to be touching, feeling, or examining people in person. That as the whole providers embrace this as a tool to use for dentists, I say this expands your chair time because about 25% of the visits to a dental office don't need to be visual hands-on. So if you eliminate those 25% and put them into a virtual consult in your schedules, then they open up 25% of the chair time, which your doctor could probably do that, could do. And we actually have a way of implementing oral health or virtual care into your practice of how to schedule it, how to make your, really efficient use of your office time. Because rather than have the staff break down a chair, clean up an operatory, get a room sterilized, get a patient checked in, get a patient, all of those things that take staff time. And right now we really are having a, employee problem of getting enough employees to work for all offices, et cetera. But rather than do that, have them scheduled for a virtual consultation at certain times of the day and open up all those operatories and chair times and cubicles for patients that need hands-on care. So it really is getting this whole concept of efficiency of running an office that will really help.
So now, do you have somebody that's out there in the field going there to talk to these different practices? I mean, to start implementing this more?
Why would I go out and do anything? No, we do almost all this virtually. Again, funny, you should ask that. We have never had an office. We don't have any brick and mortar to tell us.
No, I'm just saying, I would feel like this would be such a great thing for dentist offices to say, okay, how can we, I mean, there's businesses out there that teach you how to scale a gym, how to scale this, how to scale your dental practice. I would think if we can open up more time for chair time and then put in this teledentistry thing. That's why I was asking, do you have somebody that's going out there knocking on the door saying, how can we integrate this into your practice?
We present at national conferences. And again, dentists, except for the ones that came on board during COVID, are very resistant to change. Well, everybody's resistant to change. So we're not one of the verticals that we start out saying we're not going to try to sell to dentists because they're going to be some of the last ones to pull their head up and go, oh, this might work. But we do. In fact, I'm presenting it to Becker's in September for just basically to continue the concept of, using technology for good.
Yeah. Well, that's a good segue. I was going to ask you, I mean, what what does healthcare look like 10 years from now? Where do, with virtual care and AI, meaningfully improving patient outcomes? I mean, what do you think the next 10 years is going to be for us?
I think again, AI is such a broad sweep because a lot of offices will say they use AI, but they're just using it for managing admin kind of things. For AI for diagnosing or for assisting in diagnosis, et cetera, is still on the cutting edge. But for looking at radiographs, for instance, pretty soon there won't be as many radiologists because AI will just give them things to look at and things they need to queue up on. But with our goal is dental medical integration, which is now a buzzword. Finally, we're moving in that direction to actually incorporate, like in dental offices, they should be taking blood pressures, they should be taking blood sugars if need be, and there should be a cross integration of the dentist and the physician with this patient. And interoperability is the buzzword, is a keyword now of making sure that all charts and information can be shared. We thought that electronic charts were going to be the greatest thing since medicine, but then everybody dug into their little holes and have their own EHRs here, and they don't talk. So what benefit is it for a patient to have an electronic medical record if they go somewhere and that system's not using that same system? So now we're working on interoperability for dental records to be shared with the physicians and vice versa, so that the patient, when and if healthcare focuses on the patient's outcome, combining care will really have made progress.
I love it. So, I mean, you've had a lot of experience. We talked earlier, mother, grandmother, decades of experience in healthcare. What habits or perspectives have helped you, kind of maintain this clarity and this in pushing along this movement?
Well, I've always been a bit of a rebel. We talked about only 4% of healthcare executives are female. When I started dental school, only 3% of practicing dentists were women. So I've always sort of been charged with plowing through the challenges. And, healthcare, I say healthcare was just destroyed by COVID. It was a bad system to begin with. And we need to make sure we build it back better, but by using better choices and smarter choices. And, I'll stick at this as long as I have to or need to. But again, in talking to any healthcare facility, it's always bottom line. It's not patient care. I am a healthcare provider, but, my goal is better patient outcome. Again, I'm not sure if I said it, but like oral disease is the most prevalent disease in the world. The most prevalent disease in the world. So globally, it plagues. It's a silent plague, and it's almost 100% preventable. It's a bacterial disease. So getting, shame on all healthcare in our profession for not being able to manage the bacterial content of the mouth and helping people be able to do this. But the World Health Organization came out in 2023 with the mandate that oral health must be part of the universal healthcare plan. Right now, in terms of payers, it's still you opt into dental. And based on all the libraries full of research on dental medical integration, improving patient outcomes and improving patient health, we still make dental and vision an opt-in fee. Hopefully the World Health Organization, and they want this done by 2030, that it'll be part of the universal health care plan by 2030. Well, there just simply is not enough manpower to make that happen without using virtual care. So teledentistry globally is growing and will be growing due to this mandate of being able to do prevention, and then we'll end up with less problems. And hopefully someday they'll still be around. We will really make oral health disease not the most prevalent disease in the world.
I love it. Well, you talked about, the global impacts of all this stuff. You've done quite a bit of humanitarian and mission work. Mm-hmm. I'd love for you to touch on that and, how that's really shaped the way that you lead as a female CEO in healthcare.
Love to travel, always have, but don't want to sit on a bus or a plane or a train and look down. So started when I graduated from dental school, I went to University of Missouri, Kansas City Dental School, started the UMKC Dental Outreach Program, and we took students and faculty to different countries. We went to Peru, went to Venezuela, Nicaragua, all these programs went to different places to provide care, with students being able to provide care. And every student that ever had one of those experiences said it was the best experience they had in dental school, because they got to actually do something. They got to actually practice what they were learning. And when anybody that gets out of our bubble and sees life as it exists in the poorest of poors in other parts of the world. Yes, we have poverty in the U.S., but we have some safety nets in the U.S. where many countries have no safety nets. So that has been a wonderful way of being part of the culture. We are expanding globally as a franchise. So each country, a company in each country can take a franchise of the TeleDentist with our proven model and franchise that. And we will work with them to do it in their language, in their culture, and help them translate this into their own country, because having been everywhere, healthcare is definitely a cultural experience. It's, I'm not here to tell anybody in any other part of the world what they should or, could do. But their own people in their own countries can do that. So we are franchising globally, again, based on the WHO's objective to get this by 2030. And we were just in Uganda, just a wonderful experience. The Ugandan dentists were the most enjoyable professionals to talk with, and so open to new ways of doing things. And they loved teledentistry. There's only 300 dentists in the country of Uganda. Wow. So that's one dentist every 10,000 people. And here, our objective is to get one dentist every, I think 1,200 is the max, population. So they need a lot of help. But if we work on prevention and start prevention with small children, and you can do fluoride varnish, they now have silver diamine fluoride, which stops decay. We taught the Ugandan dentists how to use that, how to apply that and left supplies with them, and grow that, from the ground up. Then 20 years from now, hopefully we'll have a better handle on oral disease globally.
I love it. I love it. Before we wrap up, I have to ask you the question, what do you, in your career, what challenge really shaped your leadership style the most?
That's a very good question. I think it's just always being a minority is the challenge. Again, not only 4% of executives, but only 2% of venture capital money goes to women-owned companies. So we've been looking for funding. And again, it's always that, it's a challenge to get funding, but then to butt up against 98% of the other people that are going to get funding is always a challenge. I'm not a person that takes no. I take, how do you get around that no? I think that's probably had a lot of obstacles put in my way, and it's like, okay, how do I get over that obstacle? And I think I use that in when I talk with everybody I work with. It's what is your objective to get around the obstacle you're facing?
I love it. I love it. So for those listening who want to learn more about the TeleDentist or connect with you, where's the best place for them to go?
The website, www.theteledentistsplural.com.
That's amazing. That's amazing. Well, thank you for the great conversation today. And for those listening, if you're a business owner or operator thinking about how these kinds of decisions impact your business, whether it's growth, capital, or long-term strategy, that's the kind of conversations I like to have every day. So if you need a second perspective or just someone to think through it, feel free to reach out. I'm always happy to have a conversation. And if you found this conversation valuable, please subscribe to the podcast and share it with someone in your network who would benefit from it. Let's continue to build something meaningful together. Thank you so much, Maria.
Thank you. Get to the dentist.
I will.
Have a good week. Thanks for having me on.